With the worst of the Omicron wave appearing to be over, Saskatchewan talking about doing away with its vaccination requirements altogether. That is drawing criticism from the province's doctors. Michael Serapio is here with the Saskatchewan story. Michael.
Good morning, Heather. It was interesting listening to your conversation with Dr. Uni because it reminds me scientists advise, governments make policy, and for Scott Moe, the Premier of Saskatchewan, well, he believes pandemic measures have run their course. So he's looking to end vaccine passports sometime soon. And as to why the Premier is thinking of this, take a listen.
For almost 2 years now, Saskatchewan people have done what we and health professionals have asked them to do. They have followed all of the public health measures when they are implemented and when they have been necessary. They have gone out and gotten vaccinated. And people are asking their government for a return to normal, a removal of public health restrictions.
Now, you'll recall the Premier was resistant to the idea of vaccine passports, but he did reverse course, introducing them back in September, and he does credit the policy for getting vaccination numbers up in Saskatchewan, with nearly 81% of people in the province right now ages 5 and up double vaxxed. But Moe says the policy will end on or before February the 28th, and that's when the current public health order is set to expire. Now, he says those who are not vaccinated are not likely to get vaccinated at this point, a direction and message that many health experts in the province don't agree with, also pushing back on an assertion that the Premier continues to make that vaccines do not prevent the transmission of COVID-19. Here again is Scott Moe.
The bottom line of all of this is that vaccines do work, but they are no longer working at preventing transmission in this wave of COVID-19 like they previously did in the Delta wave, at which they were quite effective. And that is why the proof of vaccination or the proof of negative test requirement that we have in Saskatchewan will very soon come to an end.
Doctors and scientists, Michael, listening to the Premier there, and what are they saying in response?
Well, let's begin with that claim about vaccines and transmissions, because Dr. Angela Rasmussen, well, she is a virologist of note, a professor at the University of Saskatchewan, and she did tweet the following. She wrote, "Here is my message to Premier Scott Moe. Vaccines both reduce risk of infection and transmission." Now, on the subject of the vaccine passport, well, frontline workers and epidemiologists say any discussion about ending them is premature right now, and particularly because of the current strain on Saskatchewan's healthcare system. Yesterday, the province reporting 363 people with COVID-19 in hospital. That is the highest number of cases since the pandemic began. 42 people were in intensive care, with the Saskatchewan Health Authority saying the trajectory of hospitalizations is not sustainable given the number of people now going to hospital and the number of workers calling in sick. The public health teams, they say, are currently drowning. So a relaxation in measures is something many doctors do not want to hear right now. And to it, take a listen to researcher, clinician, and infectious diseases expert, Dr. Alexander Wong.
The challenge here is that this type of messaging around this type of base rate fallacy, this is basic statistics, and to confuse the public with this kind of a statement and then to imply that vaccines are not necessarily working and that vaccine mandates should end is not helpful to the public health messaging.
But again, Moe says he is only listening to what people want, and there was a recent poll from the Angus Reid Institute, and that institute says 62% of people they surveyed in Saskatchewan, Heather, well, they agree it is time to end restrictions.
Michael, thank you very much.